Welcome to Session 3, an introduction to narrative medicine, part of the Storytelling as Method in Design Innovation course. I'm Dr. Michael Williams. In this session, I want to introduce you to this branch of medicine known as narrative medicine that has emerged in the last 20 years. A flowering that is the result of the grafting of narrative appreciation and practice with the practice of medicine and healing. Narrative medicine emerged around the turn of the 21st century, although its roots can be traced back to earlier concerns about the social practice of medicine, referred to by some as bedside manner of doctors and health professionals. Narrative medicine grew out of the patient-centered movement, which probably we can say started, back in the 70s, which advocated for a more compassionate approach and approach to and understanding of the patient experience and the patient-doctor relationship. If there is a founder to the practice of narrative medicine, that honor could go to Dr. Rita Sharon, a pioneer and one of the authors of the recent textbook, The Principles and Practice of Narrative Medicine. Dr. Sharon is both a literary specialist and a doctor of internal medicine at Columbia University in New York. According to Sharon and her colleagues, narrative medicine draws patients, doctors, nurses, therapists, and health activists together to reimagine a healthcare based on trust and trustworthiness, humility, and mutual recognition. In the introduction to her book, Sharon talks about the evolution of this new kind of medical training. She writes, "Narrative medicine began as a rigorous intellectual and clinical discipline to fortify healthcare with the capacity to skillfully receive the accounts persons gave of themselves, to recognize, absorb, interpret, and be moved to action by the stories of others." The methods described in the book harness creativity and insight to help professionals not just to diagnose and treat patients, but to bear witness to what they undergo. Narrative medicine training in literary theory, philosophy, narrative ethics, and the creative arts increases clinicians' capacity to perceive the turmoil and suffering borne by patients and to help them to endure the chaos of illness. Since the late 90s, doctors like Rita Sharon, Arthur Frank, and Rachel Naomi Remen have advocated that medicine should be structured around the narratives of patients. The focus of narrative medicine, then, is to increase empathy through practices such as storytelling, reflective writing, journaling, art appreciation, conversation, and deep listening. The question of how storytelling and these related arts can improve healthcare education and the experience of patient care is one that is being explored in numerous medical education centers around the world, as narrative medicine has been taken up by many academic and medical institutions. Describing a reflective writing exercise, Sharon and her colleague Sayantani Dasgupta encourages clinicians to immerse themselves in the patient perspective in order to make them more aware of the patient experience. In doing so, the clinician acquires greater awareness of the emotional experience of the patient, and finally commits to action by communicating that understanding by sharing it with colleagues and patients. In this way, the clinician acquires a cognitive, emotional, and active understanding, or what has been called empathetic witnessing. Now, during the past couple of years, I've been participating in an online narrative medicine discussion forum organized by the Center of Narrative Medicine at Columbia University. One of the exercises regularly offered is an exploration through artwork and poetry. I'd like to invite you now to look at this painting and simply jot down or make note of what you see, not what you think or feel you see. What do you observe, not what you interpret, not yet anyway. And I'll give you 3 minutes just to make some notes. Now, when you finish that, take a few more minutes to write down your thoughts, your reflections, and your feelings about this painting. What does the painting evoke in you? What do you think it's about? And we'll take 3 or 4 minutes to do this, and then we'll have some sharing. Now, I'm assuming at this point that appropriate amount of time has been taken and that there has been some sharing. Well, let me say now that the painting is not all that it appears to be, although it can be whatever you want it to be. But if you've not seen this painting before, it is entitled Christina's World, and it was painted by the American painter Andrew Wyeth. It was painted in 1948, and it depicts a young woman seen from behind, wearing a pink dress, and lying or sitting propped up on her hands in a grassy field. She's looking at a farmhouse and other buildings in the distance. She appears to be relaxed, yet at the same time oddly alert, maybe even anxious or cautious. The young woman is, or was, Wyeth's neighbor, Anna Christina Olson. Now, as a child, Anna had contracted a muscle wasting disease. I think at one time it was thought to be polio, and now thought to be another sort of neuropathic muscle wasting illness. Now, rather than use a wheelchair, Anna insisted on using her arms to drag herself about. And one day, as he was looking out his window, Wyeth saw Christina crawling across the field. And in a later interview, he wrote, quote, "The challenge to me was to do justice to her extraordinary conquest of a life which most people would consider hopeless." End of quote. Well, as I said, the painting is not entirely what it appears to be. While Wyeth's experience of seeing Christina crawling across a field is real, and she is the subject of the painting, and in fact the buildings in the distance are the Olson home where Christina lived with her brother, and having inherited the home from her parents. But at the time, it was actually Wyeth's wife, Betsy, who had introduced Andrew to her husband, to Christina when they were younger, when they were courting. But it was Betsy who posed for the body, or at least the torso part of the subject here in the painting. At the time when he painted this, Christina was 55 years old. She wasn't the young woman that Wyeth had remembered seeing. And Wyeth also changed the lay of the land and separated the barn from the farmhouse. All of this suggests that the painting is more of a psychological rather than a realistic portrayal. Yet it is still painted in a highly detailed manner for which Wyeth is best known. So take a few more minutes now, and I'd like you to take what you have written and your thoughts, your reflections, your feelings, your observations, and to recreate those in an imaginative, perhaps a loosely poetic format. And that's up to you. And again, we'll give you a few minutes to do this. And when you've taken the time to do that, and I suggest that you just pause this recording and work through the exercise. And then when you come back, if you're watching this with someone else, you may want to share with one another or with a group if you're watching this with a group or a class. Right, I'd like to move on to another exercise in the time that we have together. So one of these other exercises that we engage in is similar to the one that we've just done, but this one is a reflective writing piece. In this exercise, I'm asking you to recall a time when you experienced an illness or were hospitalized, and to write a short factual account of this time. It doesn't have to be in formal prose, I should say. It might be in note form or bullet point format. And try this and write for 5 to 7 minutes. Don't overthink it, just write what comes. And again, you may pause the recording here to do so. Now, for the next step, I'd like you to take what you've written and rewrite it from the point of view of the body, or some part of it, perhaps one of the body organs or a part of the body. Make it as personal as you can, within your comfort level. And again, write for 5 to 7 minutes. And if you're with others, you may wish to share. Always remember, you don't have to share. This is very personal. You can keep it to yourself. There's no expectation that you must share your writing with others. And in the final part of the exercise, I invite you to rewrite your narrative in a different form, something different. Maybe poetry, if you haven't done that before, or as a dramatic monologue, or a dialogue between yourself and your body, or between two parts of the body, perhaps. Use your imagination and see what you can come up with. And again, take 5 to 7 minutes to do this, or longer if you need to. It's up to you. And again, you can pause this recording and undertake that. And again, if you're with others, you can share when you're finished. And continuing on, I'd just like to quote Arthur Frank. I mentioned him before as one of the proponents of narrative medicine. And he says, as you can read here, to think about a story is to reduce it to its content and then analyze that content. Those of you who've studied English will recognize that as, might call that critical reading or narrative analysis. But Frank goes on to say to think with a story is to experience it affecting one's own life, and to find in that effect a certain truth of one's own life. Now, if you're interested in these kinds of stories, medical stories, patient stories, particularly if you work in the health-related business, then what might interest you are the following website, patientvoices.org.uk. This is an organization in the UK, in England, in the south of England, that for some time now has been pioneering the use of digital storytelling, helping people, patients and others, create short videos or digital stories of their experiences with illness. And I do recommend that you go to patientvoices.org.uk to watch some of those. And you can also search for other, patient and clinician digital stories on Google. You'll find lots and lots of them. Many organizations now do this. And in fact, I've spent some time working with a number of organizations that support people with chronic illness of various kinds, ME or chronic fatigue syndrome, Parkinson's, arthritis, mental health recovery, and used digital stories and taught the skills of creating short video stories so that people with illness could create their own stories, tell their own stories, and share them with a wider public. And of course, the organizations that support those people can also, with the creator's permission, use those stories to help raise public awareness, fundraising, so on. Important to remember, too, that patient experiences can be expressed in a variety of modalities other than writing or language, expressed through the body, rehabilitation procedures, through dance, singing, artwork, yoga, massage. There are many, many different modalities, artistic modalities, in which stories can be told and shared. And just one example there, the famous Mark Morris Dance Company has produced David Leventhal's Dance for Parkinson's, inspired by the stories of people with Parkinson's. If there is any criticism or critique of narrative medicine, then this following comment may sort of represent the kind of critique that narrative medicine still needs clear and specific protocols to deepen the impact of narrative on medical practice and patients. And I believe that will certainly come in time as more clinicians and patients record their interactions, their stories, their training in the field of narrative medicine. And the more we see case studies, peer-reviewed journals and so on, I believe that will certainly happen and is happening. Finally, I just have listed just several of Rita Sharon's publications, and I do recommend them. You also Google her and go to the Narrative Medicine program's website at Columbia University, and you'll find a great deal of information about narrative medicine. And if you're interested in joining the Narrative Medicine Forum yourself, which is based at Columbia, and doing more of these exercises that I've done today, then go to narrativemedicine.blog. And there you will find opportunities to sign up to hour-long sessions and take part with others. I recommend it. I find it very illuminating, educational, inspiring, and good fun as well. So finally, thanks very much for joining me today. And this is Dr. Michael Williams, the third session, Introduction to Narrative Medicine, as I said earlier, part of the program Storytelling as Method in Design Innovation. I thank you, and I look forward to speaking with you once again in the future. Thank you.